Historical context. The history of cardiomyopathy traces back to the mid-20th century when advancements in medical imaging and diagnostic techniques revolutionized our ability to study the heart. Early on, cardiac disorders were often generalized, and the intricate details of various heart muscle diseases were not well understood. Over time, researchers identified distinct types of cardiomyopathies, each characterized by specific structural and functional abnormalities. This categorization paved the way for more accurate diagnoses and targeted treatments. Types of cardiomyopathies. Dilated cardiomyopathy, DCM. Characteristics: enlargement and weakening of the left ventricle. Effect: reduced pumping efficiency and increased risk of heart failure. Hypertrophic cardiomyopathy, HCM. Characteristics: thickening of the heart muscle, particularly the left ventricle. Effect: impaired blood flow and increased risk of arrhythmias. Restrictive cardiomyopathy, RCM. Characteristics: stiffening of the heart muscle, limiting its ability to expand and fill with blood. Effect: impaired diastolic function and compromised cardiac output. Arrhythmogenic right ventricular cardiomyopathy, ARVC. Characteristics: replacement of heart muscle with fatty or fibrous tissue, particularly in the right ventricle. Effect: increased risk of arrhythmias and potential structural damage. Causes and contributing factors. Understanding the causes of cardiomyopathies is crucial for effective management. Genetic factors. Inherited mutations play a role in certain types, emphasizing the importance of genetic counseling. Infections, hypertension, metabolic disorders. External factors like infections and chronic conditions contribute to the development of cardiomyopathies. Toxins and alcohol. Exposure to certain toxins and excessive alcohol consumption can impact the heart muscle. Effects on the heart. Cardiomyopathies manifest diverse effects on the heart, influencing its structure and function. Reduced pumping efficiency, impaired contraction, and relaxation lead to decreased ejection fraction. Arrhythmias. Irregular heart rhythms increase the risk of complications. Chamber changes. Enlargement, thickening, or stiffening of the heart chambers impact normal blood flow. Symptoms of cardiomyopathy. Recognizing the symptoms is essential for early diagnosis and intervention. Fatigue and weakness, resulting from reduced cardiac output. Shortness of breath, especially during exertion or when lying down. Chest pain or discomfort, common in hypertrophic cardiomyopathy. Swelling, edema. Fluid retention, often in the legs and ankles. Diagnosis. Accurate diagnosis involves a combination of tests and assessments. Echocardiogram, essential for assessing heart structure and function. Electrocardiogram, ECG or EKG, records the heart's electrical activity. Cardiac MRI or CT scan provides detailed images of the heart. Blood tests. Biomarkers like BNP help assess heart failure severity. Treatment. Tailored treatment strategies address specific aspects of each cardiomyopathy. Medications, beta blockers, ACE inhibitors, diuretics, or antiarrhythmic drugs may be prescribed. Device therapy. Pacemakers or defibrillators can manage arrhythmias. Surgical interventions, procedures like septal myectomy or heart transplantation may be considered. Prevention. Preventive measures focus on managing risk factors and promoting heart health. Genetic counseling, essential for individuals with a family history. Control of risk factors, managing conditions like hypertension, diabetes, and high cholesterol. Regular health checkups, especially for those with a family history or known risk factors. Conclusion. The realm of cardiomyopathies is vast and intricate, demanding a nuanced approach to diagnosis and treatment. Advances in medical science have empowered healthcare professionals to detect these conditions earlier and develop targeted interventions. Prevention through genetic counseling and the management of underlying conditions remains paramount. Ongoing research continues to unravel the complexities of heart muscle diseases, providing hope for more effective treatments and improved outcomes for individuals affected by cardiomyopathies. Historical context. The history of cardiomyopathy traces back to the mid-20th century when advancements in medical imaging and diagnostic techniques revolutionized our ability to study the heart.